February 6th, it's a day that Susana Sanchez won't soon forget.
I'm a very active person. I exercise. I've also lost 40 pounds in the past year or so. So I never thought, I thought I was, getting healthy and never suspected that this would happen, and not at this time in my life.
It was on that life-changing day when Susana went into cardiac arrest. Her heart was not beating. She was not breathing. Her family called 911.
911, what is your emergency, please?
Rose Eugene answered the call.
When you dial 911, help is on the way, but also in the meantime, it's very important that you listen to the operator so that they can give you instructions and so that you can help the patient at first hand while they're on it.
With guidance from Eugene, Susana's 20-year-old son began administering hands-only CPR just as help arrived.
These started CPR, which was continued by police officers. Miami-Dade Police Department came, and once fire rescue got there, we all worked together as a team.
The paramedics revived her and rushed her to Kendall Regional Medical Center.
This is one of those hospitals in the network that we respond to and bring patients having heart attacks. The firefighter paramedics let the hospital know what's coming. They give them the vital signs, the medications we gave. So when we appear at the emergency department, it's not a surprise. They know what to expect when we arrive.
When the team arrived at the hospital, Susana stopped breathing again. The staff at Kendall Regional Medical Center's Heart and Vascular Institute came to her aid, saving her life a second time. Susana is alive and well, thanks to emergency responders, hospital staff, and state-of-the-art technology.
The rescue behind us is essentially an emergency room on wheels. We take all of the leading cutting-edge technologies that they'll use in an emergency room, and we bring that to the patient's bedside or anywhere where that patient is, 24 hours a day, 7 days a week.
Her family's quick response also saved her life.
It feels good inside, and to see that Susie is a living testimony from just giving CPR instructions to her son, knowing that the son was at first hand while the paramedics and the police was on the way out there. It felt really good.
This is the story of just one incident that saved a life. And what we want to do today is take the opportunity with this story and hopefully go out into the community. To all those here today, all those at home, those in the community around the country, to learn the updated techniques of hands-only CPR.
Susana, her 20-year-old son, and staff were recently honored at Kendall Regional Medical Center. During the press conference, Kendall Regional Medical Center's marketing director, Peter Jude, introduced a very special guest, his father, Dr. James Jude. He and a colleague invented CPR.
It's been 50 years of CPR since CPR was presented in 1960. We are very happy that we've been able to do that, but we didn't think anything of it at the time. Oh, it was just research.
I'm appreciative of the CPR method that he invented and those other doctors, and I'm sure that's saved so many other lives as well.
There are really three parts to resuscitation. The bystander recognizing and starting CPR, then the calling 911, getting the rescue squad there, that's phase 2. And then phase 3 is getting them to the doctor in the emergency room, and they decide what to do next.
According to the American Heart Association, chest compressions alone can increase a person's chance of survival in the moments following a cardiac arrest.
Everybody should know it because it's a bystander, because you never know when somebody's going to collapse next to you.
We encourage everyone to learn CPR, to call 911, to activate the system, to get fire rescue, to take them to a hospital that continue that care, and hopefully we'll have many more happy endings.
For Susana, this happy ending comes with extreme gratitude and a life-changing message.
Enjoy life, live every day, every moment. You never know what tomorrow brings, and I was very lucky that God sent angels to help me stay here.
Kendall Regional Medical Center encourages everyone to know and understand hands-only CPR. For more information, log on to kendallmed.com. Reporting for the Healthcare News Network, I'm John Bafar.